A giant step forward. We are finally getting closer to finding out if President Obama's health care law is constitutional or not, and the Supreme Court, of course, decides that. But some elements of the health care law are already in place. What are they? And what happens to them if the law is struck down? CQ Roll Call health care reporter Emily Ethridge joins us. Nice to see you, Emily.
Nice to see you, too.
Okay, tell me, what has been implemented so far?
The things that are already in place are commonly known as the Patient's Bill of Rights. And that's things that tend to be more popular, such as letting children stay on their parents' insurance up until the age of 26. Children also can no longer be denied insurance because of a pre-existing condition. There's also some rules for insurers. Insurance companies have to spend at least 80% of their premiums on things related to health care, not marketing, not administrative services, just straight to health care. There's also a whole host of preventive services that people can get now without cost sharing, so not paying an out-of-pocket copay or not paying your deductible, different ones for adults and women and children. There's also a whole host of benefits for seniors that are already in place. One of those big things is changing the prescription drug, what they call the donut hole in Medicare, which is that coverage gap for when Medicare pays for your prescription drugs. They're starting to narrow that hole down and provide more coverage for seniors. They also gave seniors a one-time rebate check for $250 just to cover those prescription drugs. Another problem we often see in Medicare is they can't find enough primary care physicians to see Medicare patients because maybe they don't get reimbursed enough. So they started a financial incentive to give those physicians, primary care doctors, more money to see more Medicare patients.
All right, so there's actually a number of things that are in effect, but the big ticket items are yet to come, which has, I assume, like any expansion in the rolls, right? Is that the big, I mean, like the 30 million people who don't have health insurance before this, we don't have those 30 million with health insurance, right?
Exactly right.
Okay.
Those people are all still uninsured as of now.
All right, and in order to pay for those people, we're really dependent on this mandate, right?
That's right, and we have to wait for that until 2014, assuming the Supreme Court lets it stay in place. So, and that is all those state insurance exchanges that you hear so much about. Those are set to run in 2014. That's when the mandate comes into place that all Americans have health insurance or pay a penalty.
All right, if the mandate is unconstitutional and it's stricken, let's say that the rest of the law is allowed to stand, and there's even some question. I mean, it may be, if it's unconstitutional, it may get rid of the entire, it may require the entire law to fall, but that the Supreme Court will decide or not. But is there any other plan for financing if there's no mandate, is there any other plan B to finance this expansion of people having health insurance, the 30 million?
I'm sure that people right now are trying to work on that plan B. We just haven't heard a lot about those alternatives yet. Republicans, as you heard Congresswoman Bachmann just say, want to get rid of it all and start a whole new plan and package to get those people insured that has a number of different changes. But really, right now, supporters of this law are hanging their hopes on that mandate taking place.
Is there any, have you been able to determine whether or not premiums have gone up in price or not? Because that was one of the promises, and very important to many Americans, that premiums not go up. Have premiums even gone up so far?
Premiums have gone up. The problem is there's sort of a delay, obviously, in seeing when those premiums happen. We don't have up-to-date numbers on, maybe in the last 6 months if premiums went up. And like you said, a lot of these reforms aren't in place yet. But they do say, HHS likes to point out, Medicare Advantage premiums have gone down, or at least are growing more slowly. And private insurance premiums tend to be growing more slowly as well. So they say at least the trend is starting to save us more money.
All right, but at least right now they're going up, just not going up as quickly as one would expect, that somehow that this new law has slowed the increase in payments.
Exactly.
Are there any things that have been a huge disappointment so far to the Obama administration on this law?
One of the things is they had these pre-existing insurance plans they set up in the states, and that was to sort of provide a temporary situation for people who have pre-existing conditions, can't get insurance. They would kind of temporarily insure them through these pools until the states got their exchanges set up. They were estimating a few million people would get on this. It's really been about 50,000 people, and that's just not at all what they expected to have enrolled.
Is that bad, though? I mean, if the less people, I mean, does that make it cheaper or more expensive with the lesser people?
Well, it kind of depends on how sick those people are and how much money and services they need, and the administration was counting on those people paying into these pools and getting more money out of that, so now you have less people paying for that insurance. So it's kind of hard to see how that all washes out, but their estimations were definitely off on that one.
Okay, Emily, I think you're the only one in the whole city who understands this law. Thank you, Emily.
Thank you so much for having me on.
Straight ahead, quarterback sensation Tim Tebow